Hi everyone, my name is Camilla from canfitpro, and today we're here with one of our other incredible Montreal presenters, Mai-Lin Dovan. Mai-Lin, it's nice to meet you.
Hi, nice to meet you too.
So Mai-Lin, can you tell us a bit about yourself, please?
Yeah, I am an athletic therapist. I graduated from athletic therapy, Concordia University, Montreal, way back in 2001. But I've always been, a gym rat. So athletic therapy, but spent most of my life in the gym, working, in the gym as a trainer. And so really what I developed as a specialty is sort of bringing my clinical knowledge and rehab into the gym and tying that gap between what we do clinically for injury rehabilitation and what we need to do in the gym as far as strengthening to make sure that we get people back to performance.
I think that's really great. So can you tell us a bit more, like what sparked your interest in injury rehabilitation? Did something happen or did it just develop?
No, I have a lot of friends who ended up in athletic therapy because they became injured. But I actually started my, I was always into sports as a teenager, so I definitely wanted to do something at school that was related to sports. So I wound up in exercise science in my hometown. And then I was working for the hockey team at the time, and I kept seeing, athletic therapists, or people coming in with jackets that said athletic therapy. And I was like, well, I wonder what that is, athletic therapy, and so I kind of looked into it. And to be honest, the part about athletic therapy that attracted me initially was covering events, covering teams, and working with athletes and working in the sports world, right? Because I was always so into sports. And then in the end, I moved a little bit away from the field aspect of athletic therapy and started to enjoy really more the rehab aspect, but the rehab aspect that I could also, bring to the gym and tie in with strength and conditioning, really.
That's great. And I believe you do, one of your courses in Montreal is about injury prevention. Can you tell us a bit more about that, please?
The session that I'm giving at canfitpro is about movement fundamentals. I actually get a lot of, I often get a little bit angry sometimes on social media with the word injury prevention. Recently, I had a little issue with someone, and people say, well, you can't really prevent injury, and I'm like, well, you can't prevent an acute injury, right? Like an injury that you would see maybe in athletic therapy on the field after like a collision or something like that. But certainly if we think of the strength training world and the gym world, if people are not moving properly, they wind up with overuse syndromes, chronic little nagging shoulders, low back, stuff like that. And that kind of stuff really can be prevented if you look at fundamental movement and you make sure that people are moving on a solid and an optimal foundation. And that's kind of what I'm presenting at canfitpro Montreal, and that's what I do, in part of my life is teaching trainers how to do that.
That's amazing. So you said you teach trainers about the safe movements. Can you tell us a bit more about your approach to rehabilitation?
Yeah, it's a movement-based approach. It's an approach based on mobilization, activation, integration. So it's about how we structure integrating a proper movement. And I tie in the rehab initially in the trainings that I give, in the courses that I give. I tie in the rehab aspect as, what I was saying was movement optimization. So if we're looking at how the body moves, sometimes we look too much at movement or exercise, but we also need to understand how the shoulder complex functions, how the hip complex functions, and how that needs to be optimized to make sure that when you start exercising people and then you start loading people, that they're moving on a good base. So it's really to provide trainers with a strategy is how to make sure that they do that with a structure, just the same way that we structure training, right? So sometimes in the rehab world, there's that structure that's missing. We just throw in a rehab exercise and expect it to fix an issue.
That's very interesting. So you briefly mentioned mobilization, activation, integration. Can you tell us a bit more about the strategy?
The mobilization, so the three are sequences in how you would structure your intervention, where the mobilization sequence is more about creating space. So if I have soft tissue stuff that I need to address it, I would do it there. On the other hand, if I have someone who's hypermobile, I need to assess that in a different way, more proprioception and things like that. So you're just creating a better space to move within. And then in the activation sequence, you're gonna address the factors that can help promote better movement. So if it's understanding how the scapula should sit, or understanding what hip extension is so that I don't dump everything into my lower back, then that's what you're looking into in the activation sequence. And then integration is more, can I take that and build behavior on top of that? So now can I start to use exercises to kind of promote that behavior that I'm trying to reinforce?
That's great. So can you tell us a bit about movement optimization and perhaps what role rehabilitation plays in that as well?
Yeah, I think it comes back to what I was saying earlier. I think that, whenever you're rehabbing someone from an injury, you need to go back to the basic function and look at that. And then it goes either way. Even if you're not rehabbing someone from an injury, but someone's in a plateau where they're not performing as well as they want to be, or they're not able to generate as much strength as they would like in their exercises, you also have to go back and regress to the basic function so that you can optimize that movement and then be able to build to performance. So get the full performance potential by making sure the entire foundation is moving properly. So that's really how it ties into rehab or prehab, if
I love that. And I do think going back to basics is very important, because our foundation is kind of what propels us forward. So I like that prehab. So I know you've seen a lot of athletes and even people in the gym. Can you tell us about some of the most common injuries you see, and maybe how we can prevent them?
Yeah, well, prevention is a big cycle of things, right? Prevention is in structure, prevention is in strength, prevention is in movement optimization. What I see the most nowadays with a lot of my more elite athletes that are more CrossFit athletes is a lot of shoulder stuff, right? And so with the shoulder, it does often come back to us ensuring that the function is just like as optimal as possible, because the more you work overhead, the more you're prone to shoulder issues. Low back is one that comes a lot, but people come see me for all kinds of things that often they've had treatment for, but nothing as far as making sure that they're moving properly and making sure that everything else that they're doing within their training is modified to make sure that it meets their needs where they're at currently with their injury. So lots of shoulders, lots of lower back, lots of patellofemoral tendinopathy, that kind of stuff. Those are probably the most common ones in my specific practice, because the people that I work with are mostly in the gym, so they're rehabbing to go back to the gym. So a little bit less of the acute, returning from a fracture.
Mm-hmm.
But I do get some who, returning from an ankle sprain, and often what I find is that, therapy has been focused on the ankle, but no one's looked at the foot. No one's looked at, how that affects the hip, being that you're not weight bearing on that ankle for some time and you're walking a little bit differently. So those are the kinds of things that I see often. And as far as prevention, if we're looking at preventing those kind of overuse syndromes, or those kind of nagging recurrent low back pain and shoulder pain, then we really have to look at mechanics. We can't ignore the mechanics of how the shoulder functions, how the lumbo-pelvic hip complex functions, and making sure that moves properly.
I do like what you said, how we should look at the big picture, not just, the small part of the injury. So I think that's really important for us as fitness professionals as well, to do that and to think of how everything works as a whole. So in terms of looking at things as a whole, would you say with a person's lifestyle or diet, can these things help us with injury recovery, or how can they help, I guess?
They definitely can. So I like collaboration, and I surround myself with people who have different, different expertise than I do. So definitely, recovery will have a factor on your injury rehabilitation. So diet, lifestyle certainly does, having appropriate sleep, those kinds of things will all affect how well you recover from an injury, or how much strain you put your system through consistently training. So definitely lifestyle has an impact. It's not something that I coach very much, as aside from the basic, are you getting sufficient sleep? Are you recovering sufficiently between your training sessions? And if we're in a rehab situation, then certainly pain and all those kinds of things are monitored quite closely. The balance of someone's lifestyle, as far as proper nutrition and water, drinking enough water, that kind of stuff, is stuff that I'll mention. That's not something that I specialize in, but if I feel that someone really is lacking in that area, and that I think it may contribute at some point to their recurrence of injuries and recurrence of like chronic nagging pain, then certainly I have a referral network around me where I can say, you know what, I have someone who can really meet your needs in that area as well, and I think it would complement your rehab or your performance, right?
So it goes back to looking at the whole picture, which I think is so important, and I think that's great.
For sure, and it goes both ways. You need to look at the big picture, injury or otherwise, and then when you're looking at an injury, well, you kind of need to look at both. You can't ignore the injury. You need to look at the big picture, but you can't start with the big picture either. You've got to start with the injury. So it's kind of goes both ways. It's finding that balance in the treatment where that's what people are not getting, right? Because they're getting treatment for just the injury, and then not addressing the bigger picture.
I think that is so important. So we know that some people, if, as you go to the gym, if someone wants to recover from their workout, as you said, some people just, we maybe use foam rollers or stretches to prevent injury. But in your professional experience, is this the best approach to injury prevention, or are we missing something even with our clients from our cool downs or even our warm-ups?
I would say definitely from the warm-up. There are definitely some people that are not warming up appropriately. Not to say that foam rolling can't be part of your warm-up. It can be, but alone, it's not a warm-up, and alone, it's not even mobility. It's just a part of what mobility is, releasing tissues and things like that. So I think, again, there needs to be a better structure in how most people build their warm-ups, where most people put the thought of structure in their training session and not very much thought into their warm-up. That's that's something that I see getting better more and more, depending on where I go, and I tend to visit a lot of gyms, so sometimes I see stuff that drives me nuts, and sometimes I see stuff that looks pretty good, right? So I think a lot of the times what's missing is just structure and just understanding, why are you foam rolling, and are you actually doing it for the right reason or in the right places, and do you need to do it for 20 minutes while looking at your cell phone, or could you do something else, as a warm-up? As far as used as a recovery tool after training, I think definitely, if it feels what you do that feels good after a training is usually not going to be detrimental to your progress. But if you want to be more optimal in a warm-up, then there's certainly more structure to be had there. So I would build a warm-up the same way, I build my rehab interventions, when I was telling you about mobilization, activation, integration. So I would build my warm-up the same way. So foam rolling might be part of the mobilization sequence, but there's going to be a lot after that before I go into a training session.
That's great. I do think that is very important, and I do think we also need to put more time or more thought into our warm-ups and our cool downs as much as the programs, as you said.
Yeah.
So I know one of your other sessions in Montreal coming up is the evolution of personal training. with Chris Fudge, who will also be having on the show. But personally, where do you see personal training or fitness? What direction do you think it's headed in the next few years?
From my perspective, or at least what I'm trying to do is I'm trying to improve that role that trainers can have. Well, one, in a rehab process, and then two, in even a prehab or like a movement optimization, where they can have such an important impact on preventing, and maybe someone won't like that word again with me, but preventing those common injuries that we see in the gym that are oftentimes related to movement not being done properly, or people moving, or having learned to move using an exercise instead of having had the proper movement to start with. I don't know if that seems clear, but so I think trainers, if they have a better knowledge of how things should move from a very, very basic level, and then more structure as to how to build upon that foundation, I think they can have a major role in preventing people from, getting these kind of nagging shoulder pain syndromes and then recurrent low back stuff coming back because they're just a lot of the times just not working properly. So, for me, that's where I see personal training having an important role in the industry to help people to prevent these kind of things that tend to happen in the gym.
And I do think a lot of people do see, let's say, their personal trainers more than, let's say, like a doctor. So I do think as fitness professionals, it is kind of our job to help our clients move safely while maximizing their workout. So I think that's really important.
Yeah, and I think that we have, trainers have a very important role in educating the clients. So, and I think that we need to put a little bit more, give a little bit more ownership to clients, even in a rehab process, to give them some ownership of what they're going to do on their own to rehab themselves. And I think the same goes with training. So we get, if some personal trainers are seeing people 3 times a week, and these people are only with them those 3 times a week and don't train on their own, we kind of skip that education bit a little bit more because we figure, well, I'm always going to be there when that person trains, right? But what happens is when someone doesn't understand how they're moving or, how something functions, it's more difficult for them to understand how to recruit appropriately, how to, even if you're there, even if you're using cues, because cues don't teach, they don't explain, cues just remind. But if we don't do that piece of education, and I'm not saying teach anatomy, anatomy to your clients, but I think that we have to approach something like, squeezing your glutes with more like, let me show you, how your glutes work to bring your hip into extension and why that's important for the deadlift and for the lunge and for, so having a bit more of a, taking what we know really well and making it really simple for the client to understand and being able to take ownership of that. So I think that that's a big piece of education that we need to have with clients.
That's great. Thank you so much, Mai-Lin. So make sure to check out Mai-Lin's incredible sessions at canfitpro Montreal on Saturday, March 28 and Sunday, March 29, the evolution of personal training, as well as the fundamentals of movement injury prevention. So thank you so much, Mai-Lin.
Thank you.
Have a good rest of your day.
Thanks, Camilla.
Thank you.